Good morning. He said, my name is Jacques Andrepont. I've been with MD Anderson for the last 10 years, a little over 10 years. I have an MBA, went to college in Louisiana, moved here in 2002, and just been living life. I have three daughters, teenage daughters, 18, 16, and 15. Driving me nuts. So this is easier than raising them, I'll say that for sure. But I'm the director of operations at the MD Anderson in the Woodlands location. I'd like to keep up all the excitement, but talking about cancer is not always exciting. But we'd like to be here for you, and having these locations out in the community gives us the ability to offer care closest to y'all. As you can see, we have various locations across the Houston area in League City, Sugar Land, West Houston, and the Woodlands. Most of those locations will offer care similar across the board, maybe a few variations as far as services that they provide, but slowly but surely we are adding on services to get them pretty close. Our newest location is the Northwest Surgical location. That just opened in the last 6 months or so. Right now it's a surgical center. That's been really beneficial because rather than having to go down to the medical center to do surgeries and have to stay down there, pay for parking, those type of things, we have opened up that location. And in the coming 6 months to a year, we do expect to be able to expand services, to be able to do infusion care, exploring the opportunities to do diagnostic imaging and such. So really, I've been here 10 years. I've always been in the Houston area locations. Did 10 years with the West Houston location, recently moved here. It's been fun to see the expansion that we've been able to do, the services we've been able to extend to the community, so that's been really nice to see that. And we see a lot of our patients appreciate that, to not have that long drive. So in the Woodlands, while we don't offer everything that is available at the medical center, we do cover, for the most part, a lot of the major cancers, breast cancer, colorectal, all of these. Within each one of these service lines that we do have, we usually have providers that can accommodate and care for from the chemotherapy side, the surgical option, and a radiation oncology side of it to do the radiation therapy. Our goal is to bring you in and be able to offer a comprehensive plan of care that we work up with you to accommodate you and your needs, to be able to give you everything in one shot. A lot of places you'll get in situations where you go to those three providers, you'll be offered three different plans of care. Here, we're working together to try to give you one consistent plan. Not only do we deal with those specialties, but we also have supporting clinics, providers to do pain management, dermatology, plastic surgery. May not specifically be dealing with a specific cancer, but due to some of the outcomes of your care, you may need some of these other services as well. Also, with cancer care, you're going to be needing a lot of supporting services, and we want to make sure that you have everything you need, or try to do as much as we can within our location. So we do offer a lot of services like diagnostic imaging, labs, physical therapy, occupational therapy. We have nutritionists on site, social work, just to be able to provide everything you need and minimize the need to go to the medical center as much as possible. The services that we offer in the Woodlands, you don't have to be a patient of one of our providers in the Woodlands. You can, if you're seeing providers at the medical center, you can come for whatever services you need in the Woodlands. A lot of our patients that are being seen at the medical center will come in, do labs, imaging, and then by the time they get down to the medical center, all the results are ready and prepared for that provider to do their appointment with you. rather than having to sit around and wait an hour or two for those results to be brought in. If there are any services that you don't see on here that maybe you would need treatment for, those things, we're always looking to expand our footprint in the Woodlands and offering different services. We're always exploring those. So while it may not be an option now, it could be in the very near future for y'all. Also, cancer screening offered in the Woodlands. Woodlands has the most cancer screenings out of all the other locations, from screening mammograms, skin screening, colon screening, breast cancer, the lumps, and workup. We understand there's a lot of different outside services that you can seek out. It's not as important that it be done with us, but just make sure that you're getting those. Early detection is the most important thing for y'all and for the best outcomes once it's identified. So clinical trials, that always seems to be a major thing, that when the people are coming to MD Anderson, they're looking for those clinical trials. A lot of times we've been known that you have to go to the medical center to get those. We do offer medical or clinical trials out in the Woodlands. We do assess patients for that, review it. If for some reason there's not a clinical trial that's available in the Woodlands, we can always refer you to the medical center and have you linked up with the appropriate providers and teams that are doing those clinical trials. So if for some reason we don't have it, we still can care for you. So these presentations, we do offer these in different venues or opportunities. The programs are free. If for some reason there's a opportunity for this, don't hesitate to reach out. We'll be happy to do these presentations for whatever opportunities are out there. And then wouldn't be here, we always got to put a plug in for the blood bank. We're always looking for blood donations. There's always critical shortages at different times. So if there are opportunities to give blood, we'd love for y'all to visit the website, call, try to work out an appointment for that. Okay. Thank y'all.